Hi, my name is Edith Pilzer. I'm one of the pediatric gastroenterologists at GI Care for Kids. I've been in practice for the last 30+ years. Recently, I attended the NACFC meeting in October of this month. That is the meeting for cystic fibrosis. That actually is one of my interests, and I have been managing the cystic fibrosis children from a GI standpoint at CHOA or Scottish Rite for the last 30 years. It is imperative for these children to have adequate nutrition. Their long-term prognosis and long-term survival is in part related to their underlying nutrition. It is felt that all children by the age of 2 should have a weight for length of 50th percentile. And even as adults, the BMI on an adult male should be anywhere from 23 or more, and an adult female should have a BMI of 22. This goes back to their childhood, and it is felt that many times children need 110 to 200% of the normal calorie intake of an average child. Thus, we have problems sometimes getting children to gain weight, and in that situation we will typically fortify their formula some, but that has proven at times not to even be effective, and so some children have the opportunity or the suggestion of having a feeding tube. Feeding tubes actually are the dreaded 4-letter word, the TUBE. Parents often feel that they are a failure if they need to have a tube, but in actuality, tubes are quite beneficial and take out the burden of overfeeding or always trying to get children to eat. Again, children need as much as 150 to 200% of their comparative friend's calorie need, and the tube is quite effective. Some of these formulas are non-palatable, some of the formulas are just too filling, and many of these children will have tubes that will give them 50 to 75% of the caloric need that they can take in a 24-hour period. Approximately 10% of our children will have feeding tubes, and in the most recent past, 2 of my patients have been thrilled that they had tubes, as it took out the burden for the families constantly asking the children to eat or constantly trying to get them to eat. I am not saying that tubes are required for all of our patients, but again, the long-term outcome is based in part on their maintaining nutrition at 50% or more, so feeding tubes can be quite effective. Typically we will use a gastrostomy tube or a PEG, percutaneous endoscopic gastrostomy tube. There are some patients who will have an NG tube. However, in the cystic fibrosis patients, many of these patients will have sinus problems, and passing an NG tube on a nightly basis can be difficult for these patients. So they will often have a G tube or a G button. Tubes are easy. They're easy to clean, they're easy to wash. They can go in a lake, they can go in an ocean, they can go skiing. Recently we had one child whose tube actually popped out because he was wakeboarding, and the family just put the tube right back in. Obviously not the same tube, but they had a spare with them and they put a tube right back in. They're very easy to care for. Typically we don't have any problems.